All right, and we are recording. Hi everyone, I'm Hannah. I'm with the the ASA Medical Student Section, and I am the delegate to the AMA, and I'm here today with Dr. Adams from UPMC at the Pittsburgh location. Do you want to go ahead and introduce yourself, Dr. Adams?
Yeah. My name is Phil Adams, and I am the residency program director at UPMC Anesthesiology in Pittsburgh, Pennsylvania. I am in my fourth year of being the residency program director. I was the associate residency program director for 3 years before I became PD. And on top of that, I did all of my training, everything at UPMC. So I'm a bit of a lifer.
Yeah, awesome. Yeah, it's always, I feel like that really speaks to a program when somebody has stayed there for lots of years, trained there, and is continuing to train other anesthesia residents as well. All right.
Absolutely.
So, well, our first question you kind of already answered, how long you've been the program director and telling us a little bit about yourself. Is there anything else you wanted to add to that or?
I think the only thing I would add is having grown up in Pittsburgh, looked at, residency and even fellowship as opportunities to leave and go someplace new, try someplace different. But I
Mhm.
just kept coming back to the fact that there was such great training, UPMC being such a great medical center, and then Pittsburgh being such a just easy place to live. We don't have tropical sandy beaches, but we do have nice Four Seasons, and it's kind of a smaller city, but with like big city stuff in it. So it's still safe, it's still affordable. So it's really hard to pull myself away.
Yeah, yeah, definitely. It seems like a great place to live and to train as well.
Yeah.
All right, so moving on to one of our questions. It is, what do you love most about your program?
The program itself, it's a residency program in a giant system, and so we get to utilize all those resources. I love that. I mean, it's a huge referral center. There are people from all over coming in, and so I tell our applicants, I tell our residents to buckle up because for people who are too sick to be at other places, we don't really refer people out. We're kind of in we always refer to ourselves as an end organ, and so it's kind of we can't fix it, no one can. Obviously that's not true. Some people get second opinions, but it's just huge in that respect. Just seeing people from all over the world makes it a lot of fun too, to see that. So that's like from a big program perspective, but within the program, I love that within our residency program, it's always kind of like a next person up mentality. Everybody's so in it to help each other. And for me as a program director, one, it makes life easy because, we're never scurrying to cover a call shift or, when someone's sick. It's just great that everybody's so willing to help out. But then just from a teamwork camaraderie perspective, to have everybody on the same page and to be so willing to help out, um, it makes our program better, so it makes our patient care better.
Yeah, definitely. It's nice to hear that at your program, there's a lot of collaboration, it seems like. And it also seems like living in Pittsburgh, a relatively large city, and having a diverse patient population really makes residents be able to, once they graduate residency, be able to feel confident in their ability seeing so much and getting so much referrals to that hospital as well.
Right, absolutely.
Yeah. All right, so the next question we have is, how do you weigh the different components of a residency application to determine who to give, first of all, audition rotations to, and second of all, who to give interviews to?
Oh, this is like the golden question, right? I
Yes.
think every medical student wants the roadmap. They want
Mhm.
the checkbox list of if I do these X amount of things, I know I'm going to get interviews and match. I really wish it were that easy. I wish I could tell you what every program director or what every recruitment committee is thinking. I think I have a good sense. We have a program directors association that meets every year, and it's such a great group of people. And I think for the most part, every program just wants to feel confident that the people they're bringing in are going to be able to contribute effectively to the program and to the health system, right?
Yeah.
And that's going to be different no matter where you're at. So in a general sense, some of the advice that I give is I often think of getting interviews as more of a quantitative thing. And then moving up in a rank list is more of a qualitative thing. So people are going to want to look at things like your board scores, your grades, your scholarly activity, your school involvement, your community involvement. But when you're screening through hundreds, if not thousands of applications, it's really hard to get into the nitty-gritty of that. So we're looking for people that seem like they can handle a lot and be successful at it. Then once you kind of screen through and you make that decisions for the competitive away rotations or for, giving interviews, then you start to look at the quality. So, or what kind of publications were these? It doesn't even necessarily have to be anesthesiology related, but, middle author versus first author, these national presentations versus local school presentations. Is it an hour of community service here or there, or were you a leader in a community organization for the last 3 years? Just different things like that. And looking more at the qualitative, I think, is what starts to move you up in a rank list once you've locked that interview in.
Yeah, yeah, definitely. And I think every program probably is has similar things they're looking for in an anesthesia applicant as well. And with the signaling process and everything like that, that's another question we'll get to. But yeah, that's definitely something to consider. And it's good to know that there are certain characteristics that maybe weigh a little bit more heavily in an application, such as doing community service for years rather than a couple weeks here and there. So yeah, that's good to know.
Right.
Our next question is, what advice do you have for those interested in anesthesia but who are not applying this cycle?
Right. So one, that's good, because kind of knowing that you have that interest, just start talking to people, talk to everybody. Talk to people early in their careers, talk to people late in their careers. Because the perceptions of somebody who's a junior faculty is going to be far different than someone who's been doing it for so long. What is life like as an anesthesiologist? Because the way you view it as a medical student is almost like you're watching a movie. The way you live life as a resident is almost like you're the actress or the actor in the movie, like you're playing out the part.
Mhm.
But then being the attending is like being the director or the producer. You often don't see them in the movie, but they're really behind the scenes controlling every aspect and component. So each one of those is vastly different, even though we're all talking about the same subject. So just talk to everybody and anybody to get those perspectives. And then I
Yeah.
would say when it comes to building your application and am I competitive, things like that, just don't lose sight of the why you're doing the things you're doing. We take board exams, and I know step two is this like new super scary thing because it is such a kind of entry point to interviews and things like that. But just remember that you're taking that exam because you want to gain knowledge so you can take good care of people. And I think it's getting so hyper competitive. We're losing sight of that. You want to be involved in your school because you're proud of your school. You want to be involved in your community because you want to reach out and help your neighbors. So don't lose sight of why you're doing all these things. You're doing all these things to become an excellent doctor. And if you keep that in mind and you want to and you learn because you want to learn and be a good doctor, you'll get the score, you'll get the interviews, and you'll be all right.
Yeah, yeah, definitely. I think that's probably one of the best advice I've heard because I feel like when like right now I'm a third year studying for step two, it's very, very easy to get caught up in, oh, I just need to get this many questions right. But oftentimes we lose sight of why we're even taking the test in the first place, and why it's important for us to do well on it. So that's really good advice.
Yeah.
The next question we have is, how do you view the program signaling process and geographical signaling process? And how do you advise applicants to use these signals to their best advantage?
Right. So I can remember a time, BC, right? And of course we mean before COVID. And your signal then was you paid for a plane ticket, you traveled across the country, you sat in a classroom and listened to a presentation, and you put on a bunny suit and walked through an operating room. I mean, that was your signal. You weren't going to do that 30 times unless you were genuinely interested. And, COVID turned everything upside down. And the virtual interviewing, I think is great. I think there's a lot of benefits to the applicants. but it also did create an environment where nobody ever had any reason to ever cancel any interviews either. So I, to me, the signaling is really just your message of I'm not randomly applying to you. I really do have this genuine interest in being there. Okay, so that's what a signal says to me. Then it just comes down to you really have to use them efficiently.
Yeah.
Your golds are just that. They are gold because, while it doesn't really tell a program your qualifications, it does tell them that you are someone that if you saw their name on that match envelope on match day, that you would be everyone wants someone excited to be with them, right? We don't want someone disappointed they matched with us. So
Mhm.
right off the bat, you're telling that program, I really want to be with you. I really want to contribute to your program. So just, know where you stand, be
Mhm.
realistic, and just think to yourself, the highly competitive areas are that for a reason, desirable places to live, super big academic places, whatever those criteria are. But you just have to ask yourself, how many people are going to be throwing their golds at that place? And do you have the things that are going to make you stand out among all of those people? There's no bad program. And I truly mean that when I say that. We all abide by the ACGME. Everybody's got to do 20 cardiac. Everybody's got to do 20 neuro. Everybody's got to do 40 epidural. We know these numbers. So there's no bad program, but there's going to be different characteristics that make people want to be at them. And so just be sure when you're choosing who you're sending your signals to, that feasibility is coming to mind, and just thinking about how many other people are throwing their signals at those programs and how are you going to stand out among those people.
Yeah, yeah, definitely. And that's good advice too. I think it's can be hard from a student perspective, kind of knowing where you stand because all medical students have high aspirations. So you're kind of I guess, like self grading yourself in a sense and knowing where you stand. But it's definitely hard. But I think like having good advisors and things like that can always help with that. And I guess a positive sense of it too is that it maybe cuts back on application costs a little bit. Maybe people aren't as applying to hundreds and hundreds of programs
Right.
anymore either. So, yeah, definitely pros and cons. But thank you for sharing your insight on it.
Sure.
All right. So the next question we have is from your perspective, how can applicants shine during virtual interviews? And from an applicant perspective, how can we really get to know a program if it is on a virtual platform?
But, I would love to turn this around and be like, how can we as a program shine on a virtual interview, and how can we show you what a program is really like without stepping foot in it? It's awkward for both people. It goes both ways. We loved having people come. Pittsburgh's not necessarily a vacation spot, right? Like a lot of other programs in the country. So to really have people come walk our halls, see the city, see things that they maybe didn't quite think were there. And I'm sure this goes for so many other great places across the country. It meant a lot. And so we kind of hurt losing that. But from an applicant standpoint, I think that you have such a very brief moment to reinforce what kind of the great person that you are on paper, to give your interviewers the backup, showing that as good as you are on paper is how you have to come across on the screen as well. And we know that's not easy. Everybody who's interviewing you should be giving you the benefit of the doubt. We certainly try to. But I will say this, that while it may seem like anesthesiology or anesthesiologists throw up the drape and hide back behind a curtain and try to avoid people, it is such a communication sport, and I truly mean that. We are talking all day to patients, families, surgeons, circulators, scrub techs, packing nurses, pre-op nurses, consultants, cardiologists. I mean, it's just endless. And so, in particular, one of the things, at least that our program values, is we love seeing a confident, assertive candidate. Doesn't mean you have to be an extrovert. Doesn't mean we need you joking around. It also doesn't mean arrogant or cocky. But if you can portray kind of that "I got this" attitude, then when we see on paper all these amazing attributes, and then we talk to you in person, and we're just like, "Wow, they will own an operating room. This is the person we want here." That stands out.
Yeah, yeah, definitely. And that's good advice too. I feel like I'm did my surgery rotation a little bit ago, so I got to see what anesthesiologists do a little bit, and it definitely is. The whole operating room is a very like communication based setting, so it's definitely important to be able to portray that in an interview setting or maybe on audition rotations and things like that too. So that's
Certainly.
good advice.
It's a team sport.
Yeah, for sure. All right, and I think we just have one last question for you, and it is: as anesthesia gets much more competitive year after year, what experiences, activities, or characteristics make an applicant really stand out from the pack?
Gosh, it's getting harder and harder, and I would say that's probably a good thing. Because again, getting back to the quantitative, qualitative, I remember very early on, it was so much of board scores, class ranks, grades, and really not much reason to look beyond that. That's kind of how people were looking at things. And so I do think it's a good thing because a lot of that's going away. Schools are getting away from grades, schools are getting away from class rank. We all know step one is pass fail, for better, for worse, all of these things. So, how do you stand out? I again, dumb cliche sayings, but can you walk and chew gum? Just showing a well-roundedness. Are you someone who can handle the rigors of a complex clinical setting, high patient acuity, still make time to study, pass your boards, still be a productive citizen, and help with recruitment, be at different meetings and committees. And so when we're looking for things, we want reassurance that an applicant can do that. I think short of that, just being as visible as possible because we're losing a lot of in person. I would say any sort of society things that you can get involved in. So if it's the ASA and the medical student component, the Society for Education in Anesthesia is a great way to come and just mix elbow to elbow with program directors from across the country. Or if you might already be drawn to a particular subspecialty like pediatric anesthesia, cardiac anesthesia, don't be bashful. Look up those meetings. I know there's a lot of costs. It can get expensive. Some schools, maybe they have little things here and there to help defray some of those costs. Sometimes there's travel scholarships from the societies themselves. So just look for ways to be visible, away rotations. Again, just any opportunity for you to kind of be there in person and let people get to know who you are, goes a long way, in addition to looking at all those really great things on the application.
Yeah, yeah, definitely. And I think the ASA annual meeting is a good place to start too. I know it's a very big meeting, so it can be easy to get caught up in all the little details of it, and because there's a lot of people there, obviously. But yeah, it's a good place to start. I went last year, and I feel like that's the whole reason why I became involved with the medical student section. So it's a good leeway into different positions and meeting a lot of different anesthesiologists and people in general.
I agree. And just to throw out there too, while I think that opportunity is excellent, the ASA meet and greet for any student,
Mhm.
I think it can be especially useful the earlier you are. So for MS1s, MS2s, not only to see is anesthesiology the right field for you, but to also go and meet some people from these programs. Because again, it's more than a name, it's more than a location. It's really your values and it's your goals as the kind of anesthesiologist you want to become. So to be able to talk to people and see if those programs offer what will make you, the best anesthesiologist you want to be, the earlier you do that, you'll be so far ahead of the game. It'll be super helpful.
Yeah, yeah, definitely. I would agree with that. All right, so that concludes all of the questions we had. Is there anything else you wanted to add?
Just good luck to everybody, and just remember, do it because you love it. It
Mhm.
might not seem like that when you're studying, but that studying is gonna pay off in the long run when you're doing what you love. And yeah, we need great people in anesthesiology. So can't wait to meet you.
Yeah, definitely. Thank you so much for your time today.
Yeah, thank you. This is awesome. Take care.
Yeah.